Hi, good evening. My name is Brianna Esparza, and I will be covering therapies in Chapter 15. My three concepts are psychotherapy, biomedical therapy, and behavioral therapies. I'm going to be covering each type of therapy, what they are, and how they are used in psychology. Ultimately, the goal of the different types of therapies that exist are to improve relationships and social skills and to target whatever the problem may be affecting the individual. The first topic I will be discussing is psychotherapy. Psychotherapy is the treatment of mental disorders by psychological rather than medical means. Psychotherapy is based on regular person interaction to help a person overcome certain problems. Psychotherapy can help people of all ages live healthier, more productive lives. It is commonly referred to as talk therapy because it involves communication between two individuals, usually the therapist and the person being treated. Psychotherapy targets emotions and as well behavior. Psychotherapy focuses on the role of thinking in what a patient feels and does. It is a blend of cognitive therapy and behavioral therapy, examining a patient's thoughts and beliefs as well as their actions. It is aimed to change their thinking and harmful behaviors. Basically, during psychotherapy, you talk not only about how you're feeling, but you also express the behavior following your feelings in order to target the problem and be able to find a solution. Signs that therapy could help an individual are when one is feeling overwhelmed or a prolonged sense of sadness and helplessness, when one finds it difficult to carry out tasks or interact with others, when one works excessively and expects the worst or is constantly on edge, when one's actions, such as drinking too much alcohol, using drugs, begins an aggressive and harmful behavior that could potentially harm not only oneself but those around. For the purpose of a better explanation, I will be demonstrating psychotherapy, otherwise known as talk therapy. I will be participating as the therapist, and my volunteer is participating as the patient. Most therapy sessions involve the basic introductory questions as well as an introduction. My name is Brianna Esparza. What is your name?
Sarah Ebley.
Okay. What brings you here today?
I've just been noticing a change in my mood. I've been feeling pretty down, and it's just not normal to me.
Okay, interesting. And what do you think is the problem from your viewpoint? Do you think there's any problems?
Um, Not that I know of. Maybe stress.
You think you're stressed? Okay, interesting. What do you think stresses you out? Is there anything in particular going on in your life at the moment?
Maybe the stress that I get from my job and from trying to juggle school and a social life, and.
Okay, cool. Where do you work? Where do you go to school?
I work as a waitress at Olive Garden, and I currently go to UCI.
Okay, interesting. Thank you. In a therapy session, other questions can be asked, such as how does the problem make you feel? What makes the problem better for you? Or have you noticed anything that makes the problem better? Overall, how do you describe your mood? The point is to keep a person talking to really be able to understand why they're acting in a certain way or what is going on in their emotions that could lead to certain behavior. Next, I will be covering biomedical therapy. Biomedical therapies are psychological interventions that focus on the reduction of symptoms associated with psychological disorders. Basically, biomedical therapies involve medical treatment such as drugs or surgery. They are the patient is treated in a more of a medical way, And three procedures that are used for biomedical therapy are drug therapies, electroconvulsive treatment, also known as shock treatment, and psychosurgery. First off, drug therapy relies on medication, such as these, for the treatment of mental disorders. Sometimes it is used in conjunction with psychotherapy. So both can be used together. Drug therapy can help with anything from anxiety drugs to antipsychotic drugs, such as a person suffering from schizophrenia. There are also antidepressant drugs from a person who is suffering from depression. And as I mentioned, anti-anxiety drugs would help target a person who has high levels of anxiety or suffers from anxiety attacks. Shock therapy was developed in the 1930s before many drugs were created and available. Shock therapy involved shock being administered to one or both sides of the brain through electrodes placed over the temporal lobes, producing a brief convulsive seizure during which the patient becomes unconscious. It was widely used in the 40s and in the 1950s, and there has been a decline in use of shock therapy. Drugs have grown in favor, and people argue that it is not effective as it was once believed to be. Next, psychosurgery was also developed in the 1930s, and it is a type of neurosurgery designed to change psychological or behavioral reactions. It is rarely used today. Uh, Psychosurgery basically involved a surgical procedure on the brain that would, in some sort, change the behavior of the human body and how they would react to certain situations or events. Amongst the different types of biomedical therapies and the different procedures, drug therapy is the most commonly used today, and it is, as I mentioned, it is used in conjunction with psychotherapy, so that is the most popular. Lastly, I will be discussing behavioral therapies. Behavioral therapies is an umbrella term of different types of therapies that treat mental health disorders. This form of therapy seeks to identify and help change potentially self-destructive or unhealthy behavior. Behavioral therapy functions on the idea that all unhealthy behavior is learned, and therefore all unhealthy behavior can be changed. Cognitive behavioral therapy. Cognitive behavioral therapy is extremely popular. It combines behavioral therapy with cognitive therapy. The treatment is centered around how someone's thoughts and beliefs influence their actions and moods. It is often focuses on a person's current problems and how to solve them. The long-term goal in cognitive behavioral therapy is to change a person's thinking and behavioral patterns to healthy ones. The next one is cognitive behavioral play therapy. Cognitive behavioral play therapy is commonly used with children. By watching children play, one is able to gain insight into what the child is uncomfortable with or what they may not be able to express. Children may be able to choose their own toys and play freely, so that can say something about their behavior or what they may be thinking. In this type of therapy, children may be asked to choose their own toys or to draw a picture or to create a scene with their toys. The next one is system desensitization. System desensitization, relies heavily on classical conditioning. It is often used to treat phobias. People are taught to replace a fear response to phobia with a relaxation response. So, for example, if you're scared of the dark, it is treated with something that relaxes you. Once mastered, a therapist will slowly expose them to their fear in a heightened doses, and the practice and with practice techniques. So again, as I said, if you're scared of the dark, we would start with small steps of being outside in the dark. Lastly, there is aversion therapy. Aversion therapy is often used to treat problems such as substance abuse and alcoholism. This type of technique works by teaching people to associate a stimulus that's desirable but unhealthy with an extremely unpleasant stimulus. The unpleasant stimulus may be something that causes discomfort. So, for example, one may teach you to associate alcohol with an unpleasant memory. If I dislike animals, for whatever the reason may be, I would link alcohol to the particular animal that I dislike. Therefore, when I think of alcohol, I think of what I don't like, and making it an unpleasant memory. In conclusion, therapies in psychology can vary. There is biomedical therapies, there is behavioral therapies, and there is psychotherapy. Biomedical therapies include anything from drugs to a surgical procedure. Behavioral therapies aim to change a certain behavior with the idea that we learn behavior, therefore we are able to change how we behave. And psychotherapy is based on the idea of talk therapy. Through communication, we are able to target issues and problems in one's life and rearrange them in a way that positively affects the person.